Ladies and gentlemen, please join me in welcoming Dr. Wiley Chung for his talk, Unleashing the Power of Teamwork in Healthcare.
Thank you. Ever since I was a little boy, I always saw healthcare providers as saints who could do no harm. They were healers, protectors, and the hospital was a safe haven where people showed up sick and they got fixed. But now, as an experienced clinician, I've realized that despite our healthcare providers always trying their best, it doesn't always mean our patients will be okay. I'm Wiley Chung. I'm a thoracic surgeon and director of interprofessional education here in our medical school at Queen's University. And like most academics, I wear multiple hats. As a researcher, I study how healthcare teams function, and I look at ways to make them work better together. As a Reznick Scholar of Health Professions Education, I design initiatives that help prepare our graduates from different health professions for collaborative practice. And when I refer to our learners today, I'm talking about our future nurses, doctors, occupational therapists, physiotherapists, public health scientists, and more. What I will talk to you about today is going to affect all of you. 85% of people in North America interact with our healthcare system at least once this year. And for some of you, it may be an average of 9 times. Now, here's the kicker. According to the World Health Organization, 4 in 10 patients face unintentional harm when interacting with healthcare providers. And what blows my mind is that 80% of this harm, up to 80%, is actually preventable. And although the factors that contribute to harm are complex, we know it's related to poor teamwork. We know this because teams in healthcare are siloed and they're hierarchical. In fact, it reminds me of an article I read the other day. The article says 70% of patients who died in one particular emergency department in the UK was related to poor teamwork. Today, in my time with you, I want to talk about 3 points. My first point, I want to share with you a misbelief that I've identified from our research. Second, I want to tell you about what my educational development team and I are doing to mitigate this. And finally, I want us all to envision the future together. So what is this misbelief? It's that as healthcare providers, you only focus on what you do as an individual to improve your patients' outcomes. The harder you work, the more you sacrifice, the better the outcomes. It sounds pretty logical, right? I wish it was that simple. See, although this belief makes us responsible to our patient, it's actually a double-edged sword. It makes us disregard the rest of the team, which is our strongest resource. And if we continue to carry this mindset when we face our next challenge, we end up problem solving in isolation. And all these clever ideas from our teammates and our colleagues that could potentially benefit our patients are never heard. Sadly, this way of thinking is very common in healthcare. In fact, it's actually ingrained in how we train our future healthcare professionals. This is why many graduates entering practice continue to think this way. Now, reflecting on my own training, I too believed this. I believed that the harder I worked, the more I sacrificed to be the best surgeon I could be, that my patients would be safe. What I later learned from my research was that this actually fosters a human tendency known as self-serving bias. This bias occurs when we attribute positive outcomes to our own character, and when negative outcomes occur, we attribute it to others. So what does this mean in healthcare? This translates to us patting ourselves on the back when our patients do well, and when unexpected complications occur, we have a tendency to blame others. And it's not that we're bad people. It's just that it's more natural to blame others when you don't really know them and when you don't really understand what they do. However, we must confront reality and avoid this. Patient outcomes don't depend on a single individual. It depends on an entire team. In fact, our research identified that if you are a patient admitted to an internal medicine ward, you interact with up to 18 healthcare providers on average. And if you're admitted to a surgical ward, it's even higher. The average is like 27. I just want to change gears now and share two stories that have really helped me understand the importance of teamwork. After medical school, I started my residency at the University of Toronto. And I remember one morning in one of the hospitals, I was there seeing one of my patients. And out of nowhere, a code blue was called. And it was for the patient directly right across from us in that same room. And within moments, an entire team of healthcare providers rushed in. They were doing chest compressions. They were doing everything possible to try to get this patient back to life. Despite 30 minutes of their best efforts, they were unsuccessful at reviving him. I still remember the lead physician and what he said that morning. He said, time of death, 10:46 a.m. And I'll never forget the numbers 46. That was the patient's age. He was a father of two, a husband, a son, a brother, and he was a skilled professional. Our debrief later that morning identified one key piece of information that was missing. He had a chest tube protruding out of his chest. And for those of you who are not familiar with what a chest tube is, it is a special tube designed to help a collapsed lung re-expand in the chest cavity by sucking the air out. The only problem with this tube that morning was that it was clamped shut. And because it was clamped shut, the tube can't function, and the lung remained collapsed. And in fact, the air pressure had built up so much in that patient's chest cavity that it ultimately killed the patient. Our debrief also identified another key piece of information. One of the team members had actually noticed that that tube was clamped shut fairly early on, but they didn't say anything because they did not know the significance of that. And they felt too uncomfortable and scared to interrupt the team to ask a question. They did not want to be risked being judged in a high-stakes situation. What we learned from that situation was that had the team been more collaborative, that team member would have felt more bold to ask their question, and that chest tube would have immediately been unclamped, and that patient would have likely survived. that experience helped me realize that it doesn't matter, it doesn't always matter how skilled or knowledgeable we are as healthcare professionals, that we truly are stronger together than apart. I want to share with you now another story that helped me learn my second lesson about the importance of teamwork in healthcare. A few years later, I was on call, and I faced the unimaginable. And of course, it had to be my first year of practice. A helicopter had transferred a teenage boy from a surrounding hospital to our emergency department. It was an arrow injury. And when the patient arrived, he was sitting straight up in the stretcher. And the arrow was through his chest. The entrance point in the front of the arrow was here, and the back of the arrow was right here, sticking right out of the patient. It was like a scene from a zombie movie, except our patient was alive. He was alert, he was oriented, and he was speaking in full sentences, and he was scared. And to be honest with you, we were all scared. None of us had ever seen anything like this before. Patients like this usually die out in the field. They don't survive transport to hospital. As we transferred the patient to the operating room, we all just backed away. Nobody wanted to bump into this thing. And I still remember the double doors in the OR as they opened. There were at least 40 healthcare providers scrambling to the edges of the room like ants. And the room went from a bustling chaos to this eerie silence. And they all looked shocked. They had never seen anything like this. And they all knew that this was a high-stakes situation and that any errors in management or any inadvertent movements of that arrow could lead to instant death for the patient. And in the room, we had nurses, we had anesthetists, we had anesthesia assistants, we had cardiac surgeons, thoracic surgeons, we had the entire trauma team. We easily had over 200 years of clinical experience packed into that one single room. And that day, we all had one job. We had to remove that arrow safely. We had to repair any injuries we'd identify. But in order to do that, we would need an unconscious patient hooked up to a breathing machine. And we would rely on our anesthetist to connect a breathing tube to the breathing machine, place it into the patient's mouth and into their airway. The only problem was that our anesthetists are used to working with patients flat on their back. And as you can see, with an arrow pointing out of your back, you can't really do that. And so the workaround was we placed the airway tube in a position for the patient where they're upright in this awkward position and they're fully awake. This was the safest way that we could be sure we wouldn't move that arrow. At that moment, despite having a good plan, something life-changing happened. I started having flashbacks of when I was in residency. I remembered the patient who died. And I remembered the team member who was too scared to ask a question. And I was terrified that we would make the same mistake that day. And so I said, team, listen, we've got a good plan. But to be honest with you, I've never seen anything like this before. Does anyone here have any ideas or suggestions before we proceed? From the corner of the room, a junior team member puts up their hand and says, my father's a hunter. That arrow is not solid. I'm pretty sure that arrow is hollow. We can cut that arrow and then lay the patient flat. Another voice in the room comes and says, cut the arrow? What do we have in the OR that could cut the arrow? Another voice across the room says, we can use the rib cutters. Those shears that we use to cut ribs for our chest wall cases, we could use that. And that's exactly what we did. We grabbed a set of rib cutters, we cut that arrow, flush against the patient's back. We laid the patient flat. The patient had an uneventful anesthetic. We removed the arrow safely. We fixed any injuries we identified, and the patient survived. Now, for those of you who don't really believe me in this story, I brought something for you. So this is half of the arrow. This is the part that was inside the patient, and this is the part that we cut. This was a gift from the patient. And if you want to see the other half, I can show you after. That moment in the operating room was transformative for me. It ignited a passion in me to focus my research on looking at how healthcare teams function. And we learned a lot. We learned that if we can get teams to work better together in healthcare, certain outcomes could improve for 30% of patients. We also learned why we're not so great at teamwork. Currently, every healthcare professional in North America is trained in a distinct curriculum that is developed separately from all the other disciplines. This makes it very difficult for our learners to meet anyone outside of their program. And this is why they don't understand the roles of other health professionals. This is why they don't know how to see one another as a resource. At Queen's, our vision of the future of healthcare includes one where our healthcare providers respect one another. And our vision extends outside of healthcare. Our educational development team, including our educational developers, our leads from different health disciplines, and myself, are leading an initiative that's going to revolutionize the way we teach teamwork in healthcare. By 2026, as part of the Radical Collaboration Mandate at Queen's Health Sciences, we will make 20% of our curriculum shared across all programs in the School of Medicine, Nursing, and Rehabilitation Therapy. We will create an environment where our learners don't just learn with one another, but they also learn about one another and from one another. We want to eliminate all stereotypes, biases, and hierarchies across all the professions. We're going to create case-based learning in teams. We're going to create simulations where our learners from different health professions can practice working together in a team in a highly stressful simulated situation. This way, they're going to be better prepared for clinical practice when real patient lives are at stake. At Queen's, our vision of the future of healthcare is one where our healthcare providers respect one another. And our vision also extends outside of healthcare into any career where teams exist. And when I talk about respect, I don't mean smiling or being polite or being courteous. I mean truly understanding the lens through which our colleagues care for patients, valuing one another's opinions, and truly seeing one another as a resource. Now that we've envisioned the future together, I want to leave you with one last thought. The average clinician sees about 2,000 patients a year. This means that our graduates collectively at Queen's Health Sciences will see 1 million patients by next year. Imagine if we could improve outcomes for 30% of those patients just with better teamwork. That's 300,000 patients benefiting from our initiative yearly alone. Now imagine if every training program in North America did this. In today's climate, when most initiatives are limited by funding constraints and budget cuts, our vision at Queen's is feasible. All we have to do is to teach our learners how to tap into their greatest resource, which is one another. Thank you.